Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, do you know which gland in the body is called the master gland?
I do, only because I looked ahead on the notes.
You read the script,
I
didn't you?
did.
The pituitary gland. Now, it's a tiny organ about the size of a grape located at the base of the brain, but it produces a variety of hormones that are released into the bloodstream, and these hormones influence nearly every part of our body, including stimulating other glands to produce other hormones. There is a reason they call it the master gland.
That's a lot to do when you're a grape-sized organ.
True.
But things can go wrong. The most frequent type of pituitary disorder is a pituitary gland tumor or abnormal growth. Pituitary tumors are actually fairly common in adults. And joining us in studio is a pituitary expert, Mayo Clinic endocrinologist, Dr. William Young. Welcome back to the program, Dr. Young.
Thank you, Tracy. Glad to be here.
Dr. Young, so good to have you to talk about the master gland. So it's about the size of a grape, but summarize for us all of the different things that it does.
Right. So
in 50 minutes or less.
50 minutes. I can do this. It's a small grape. It's about the size of your thumbnail. Sits straight behind the bridge of the nose and just in front of the ears. It's at the base of the brain. And I describe it to patients as if it's a small cherry hanging down from the brain on a little stem. So it's not brain tissue, it's a gland tissue. And it does 4 big jobs in all adults. It tells our thyroid gland to make thyroid hormone every day. If we don't make thyroid hormone, everything slows down, the heart's slower, no energy, constipation, and eventually you can go into a coma if you don't make any thyroid hormone.
Well, really, I thought the thyroid regulated itself, but obviously not. The thyroid is regulated by the pituitary.
Right. Without a pituitary gland, the thyroid would not work. Yep.
Amazing.
That's why the pituitary is the master gland.
So we got the thyroid.
Yep. And then it tells the adrenal glands. The adrenal glands sit on top of the kidneys, little triangular structures, and they make cortisone. And we all need cortisone to live. Without cortisone, we can't survive. It's important for all the cells in the body. So the pituitary tells the adrenal glands to make cortisone. So that's another very important job. The third job in adults is it tells the gonads, the testicles in men, the ovaries in women, to make their respective sex hormones, testosterone in men, estrogen in women. And not only does it tell them to make those hormones, it tells the gonads how to be reproductive in terms of making sperm and releasing eggs. So it's important for reproduction. Without a pituitary gland, humans wouldn't be able to reproduce. We wouldn't have a human race. So this is really an important little gland at the base of the brain. And the fourth job in adults is telling the kidneys how to save water. So it's constantly, our pituitary and our hypothalamus, which is just above the pituitary, is constantly measuring the concentration of our blood, whether we're dehydrated or overhydrated. So if you drink that bottle of water real quickly over there, you're going to be overhydrated. The pituitary will sense that, and
thanks for reminding him.
The pituitary will sense that and will turn off its hormone called antidiuretic hormone. And without antidiuretic hormone, the kidneys don't concentrate urine at all. So what's filtered at the kidney just goes out through the ureters to the bladder, and the patient urinates. Whereas if it's a hot day and you're outside, you don't have access to water, and you're sweating, then you're becoming dehydrated. The pituitary senses that, and it makes a lot of antidiuretic hormone. So it tells the kidney, save water, save water, save water, so that you don't become dehydrated. So it's a really important part. That's the back part of the pituitary gland that does that. If that isn't working, a human would have to drink 10 to 12 gallons of water every day just to stay hydrated. You're continuously drinking because the kidneys don't save water. Juice goes right out.
So if you have thyroid problems or adrenal gland problems or any of the 4 that you just listed, why is it then that people go in and they have their thyroid treated, or is it a pituitary problem? Or how do you know that it's not a thyroid problem?
Oh, Tracy, that's a great question. That's what endocrinologists do.
Okay.
They figure out where's the problem. Is the problem at the thyroid, where the thyroid itself is decided it's not going to work very well and it's not going to listen to the message from the pituitary? Or is it a pituitary problem? So we actually measure the pituitary hormone called thyroid stimulating hormone. So that's the hormone the pituitary makes to tell the thyroid to make thyroid hormone. If the problem is something called Hashimoto's thyroiditis, where the thyroid slowly becomes damaged and it can't make thyroid hormone, the pituitary, which is constantly sensing thyroid hormone in the blood, says, hey, thyroid, get going. Come on, get going, get going. So it makes more TSH. So TSH levels in the blood go up. And so we measure TSH. So when someone's hypothyroid, the first thing you do is measure TSH. If TSH is high, that's telling us the thyroid failed. Whereas if TSH is low, that's telling us there's a problem at the pituitary.
You know, you have done an amazing job of summarizing all that the pituitary gland does. And it does these by releasing chemicals called hormones to control all of these things?
Right. So hormones are small structures, typically a series of amino acids for small proteins that lock into a receptor. So the way to think how hormones work, the nervous system is more like an electrical system. So the left side of my brain's telling my finger to go up right now. It's telling it to go down. It's lightning fast. It's instantaneous messaging. With hormones, it's more like a radio broadcast. So a hormone's released from a cell. It's sent out into the bloodstream this message. And it will not work unless there's a receptor. So you have to be tuned into 106.3 or whatever to get this message, and that's called a receptor. So the hormones that's circulating locks into that receptor, and that's what causes the action.
Pretty amazing. Now, why is it that we don't hear more about the pituitary gland? As important as it is, I mean, I'm sure you deal with it every day. People do have problems with their pituitary, but we rarely hear about it.
You hear it's all thyroid.
People, right?
Thyroid's getting all the press.
Well, Tom, if it was up to me, we'd be hearing about the pituitary every day. And I'm glad I'm here today.
Yeah. Everybody across the country is going to hear about it now. So things can go wrong. So let's talk about what can go wrong.
Right. I do want to mention two other jobs.
Sure.
The pituitary has, because this
there more.
This impacts what can go wrong. So there's another hormone from the pituitary called prolactin, and prolactin has one role in humans, and that's for breastfeeding. So when a woman is pregnant, prolactin levels from the pituitary start rising through pregnancy, getting the breast ready for breastfeeding. So by the time after delivery, the breasts are ready to breastfeed. And then prolactin stays high as long as a woman breastfeeds. So that's an important job in women after pregnancy. Men make prolactin too, but we don't know of any function in men for prolactin. And the last hormone I want to mention, which is really important, that's why we're all as tall as we are, is growth hormone. So growth hormone is important in childhood, and it's necessary for growth. And, decades and decades ago, we weren't able to diagnose growth hormone deficiency in children. We didn't have a treatment for growth hormone deficiency. And there would be a lot of people that never grow very tall because their pituitary wasn't making growth hormone. But now we can diagnose it and we can treat it, so children whose pituitary isn't working can reach a normal adult height.
Pretty rare, though, isn't it?
That is quite rare. That's correct.
And what's more common? Well, more common disease of the pituitary.
So the most common disorder related to the pituitary is a pituitary tumor. And you may be surprised by this, but 1 out of 5 adults has a small pituitary tumor.
1 out of 5?
Yeah.
That's impressive.
There's 3 of us here.
There's 5 of us in
there's
this
actually
room.
5. It's not me.
No comment.
Now you could say, well, how do I know that? Well, I know that based on a study done at Mayo Clinic in the 1920s. So this was a pathology resident, somebody training in pathology. And at our main hospital in Rochester, Minnesota, St. Mary's Hospital, he did 1,000 autopsies. These are people who died of non-hormone, non-endocrine disorders. And he sliced up the pituitary very finely. And he found 1 out of 5 people had a little pituitary tumor. Now, it didn't cause them any problem during life. So although 1 out of 5 of us have a small tumor, it usually is not a medical issue. And we've replicated that recognition of how common pituitary tumors are with our head MRI scans. As our head MRI scans have gotten better and better, we're finding these small tumors in the pituitary gland. We call them pituitary incidentalomas, because usually the head MRI is done for headaches or some other problem. And you stumble over this little pituitary tumor. Then it's up to an endocrinologist to figure out, is this important for this patient yes or no.
So that suggests that most of the time pituitary gland tumors are, number one, benign, and number two, of little significance.
That's correct.
Don't need to be treated.
Right. I'm not here today telling everyone to go out and get a head MRI scan to look for a pituitary tumor. That includes us.
All right. One of the five of us has probably got one. All right. We're talking with endocrinologist and pituitary gland expert, Dr. William Young. Time for a short break. When we come back, we'll talk more about pituitary gland tumors, including how they're diagnosed and how they're treated. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We are with endocrinologist Dr. William Young. He is also a pituitary gland expert. We've talked about all the important things that the pituitary gland does and why it's referred to as the master gland. We've talked about things that can go wrong, and the most common thing is a benign pituitary tumor. And one out of five, everybody has a pituitary gland tumor that is probably not clinically significant. So let's talk about the ones that are. What are the symptoms, and how do you make the diagnosis?
Right. So we can walk through the different hormones the pituitary makes one by one. Every cell in the pituitary has the potential to turn into a pituitary tumor. And if it does, it'll make its own hormone. And as that hormone rises, it'll typically cause signs and symptoms related to excess of that hormone. For example, growth hormone. So growth hormone's needed for growth. Once the bones fuse, the epiphyses fuse in the bones, in adults, we can't grow anymore.
Those are the growth plates.
Those are the growth plates in bones. And we can't grow anymore. But if you had a pituitary tumor making growth hormone, it does result in fairly characteristic signs and symptoms. So what happens is the shoe size gets wider, the fingers get thicker. So if someone wears a ring, they have to have it cut off, they get it resized, and then a couple years later they have to cut off again and get it resized. These people, the pitch of the voice box gets wider and the pitch of the voice drops. So the woman's voice gets lower, the men's voice gets lower. The frontal bone of the forehead that can grow a little bit, and it grows out a little bit. We call that frontal bossing. And the jawbone, the mandible, can actually grow in adults, and it'll extend. So what happens, these patients with growth hormone producing tumors get an underbite. So many times it's diagnosed at the dental office, when the patient's coming in and say, my teeth don't fit. And that's because they developed an underbite. Their tongue gets bigger and thicker, so they have more trouble enunciating words. They have excess sweating. They're at increased risk for colon polyps and colon cancer.
The list of things that you're saying, though, they sound like those are things that happen over time, like your fingers getting bigger and your tongue. That must be very slow growing. And
Tracy, you're spot on, because the average duration of symptoms before someone's diagnosed with a growth hormone-producing tumor is 8.5 years.
oh my goodness.
So that's one of the types of tumors. Do you see multiple different kinds that develop?
Absolutely. So another type of pituitary tumor is ACTH-producing pituitary tumor. ACTH is the pituitary hormone that tells our adrenals to make cortisone. And if you have a pituitary tumor that's making too much ACTH, it tells the adrenal glands to make too much cortisone. So that also leads to a very characteristic presentation. Too much cortisone is called Cushing syndrome. It was described by Harvey Cushing in the early 1900s. And these patients gain weight. As they gain weight, they redistribute the body weight to the central part of the body, above their clavicles and behind the neck. And excess cortisol breaks down muscle, so the arms and legs get skinny, actually. So skinny arms and legs, but increased body weight, increased body fat in the central part of the body. The skin gets thinner. So what happens when they gain the central weight, they get these purple-red stretch marks on their abdomen. And because they're losing muscle, it's hard for them to go upstairs. It's hard for them to do a deep knee bend. Too much cortisol causes high blood pressure, causes diabetes. So the face gets kind of round and red. Women will lose hair on the top of their head. So it's a real characteristic presentation. Again, fortunately rare. But that's another type of pituitary tumor.
And are most of these diagnosable with a blood test?
It's complicated, like most endocrinology disorders. Cushing's syndrome, sometimes, so people may gain some weight, they may go on the internet, read about Cushing's syndrome, and they come to see us to see if that's the reason they've gained weight. And it's very hard, actually, to distinguish between mild Cushing's syndrome and someone gaining weight for other reasons. Other times, the patient comes in as very characteristic with all those signs and symptoms of Cushing's syndrome.
So once you have, is the diagnosis also partly based on imaging, an MRI scan, so you can actually see the tumor and see the growth inside the pituitary?
It is. That's part of it. It's not the first step. The first step, if you think someone may have Cushing's, is to measure cortisol. We measure cortisol in the blood. We measure cortisol in a 24-hour urine collection, so it's all the cortisol we make in a day. And we measure cortisol at midnight in the saliva. So in a normal person, cortisol levels are highest in the morning, they come down in the afternoon, and they're lowest at night. We don't have a good way of drawing blood at midnight in outpatients, so we actually measure cortisol in the saliva at midnight. It should be low, whereas if it's not low, then that could tell us our patient has Cushing's syndrome.
And once you've made a diagnosis of a particular type of tumor, what are the treatment options?
Well, fortunately, there are good treatment options for all patients with pituitary tumors if surgery is indicated, and that's called transsphenoidal surgery. It was first developed by Harvey Cushing in the early 1900s. The problem back then, we didn't have antibiotics, so most of the patients developed infections and didn't have good outcomes. But with the development of antibiotics, a neurosurgeon in Montreal, Jules Hardy, developed this transsphenoidal approach to the pituitary. And by that, I mean...
Wait a minute. Now, this has got to be a tough spot to get to. Oh, transsphenoidal. So
yeah.
That means through the nose? Through the front of the face? Or
well, it used to be through the front of the face. It used to be above the upper teeth and under the lip. But probably about 18 years ago, it doesn't sound so good, does it, Tracy?
It was the hair on the back of my neck kind of went, ooh.
But about 18 years ago, a scope version of this surgery was developed. So now our neurosurgeons go through the nostril, and they can go through the nostril, tunnel through the back of the nose, and make a little hole in the bone where the pituitary sits.
And do the surgery, get rid of the tumor.
Right.
I'm sure you would like to be asleep for this.
I think so. I just have to ask, if 1 out of 5 people has this, and the master gland controls so many of the different things in the body that can go wrong or be right, why isn't it one of the first things that your doctor checks when you go in? Can you just get a blood check on how your pituitary is doing?
So that's a good question, Tracy. There's not like one pituitary blood test because it does come back to each of those hormones.
Each of those hormones.
And each of those glands. So we do it more based on the symptoms the patient may present with. You know, for example, the fingers getting wider, or the person's gaining weight and getting those purple-red stretch marks.
Does something's not right count as a symptom?
It can. Usually something's not right is not specific enough for the pituitary gland.
Mm-hmm.
What about other treatment options? Do you ever use radiation or medications to treat tumors of the pituitary?
Yeah, right, Tom. So again, fortunately, we have a good surgical approach, and there are expert neurosurgeons that specialize in operating the pituitary. But there are patients where the tumor is so big and it's going into an area that the neurosurgeon can't safely get into, and this is around the main blood vessels that supply the brain. So you can do what we call debulk the pituitary tumor, but there's still some left, and that's where radiation comes in. And the optimal radiation therapy is usually a focused form of radiation therapy. It's called radiosurgery, although there's no knives involved. It's a big helmet. It's called Gamma Knife, and this big helmet has 210 holes in it, and each one has a gamma gun. And you focus them all to that same spot from all these different directions. So the idea, it's kind of like a magnifying glass, hot summer day, sidewalk, dry leaf, and you can burn a hole in that leaf. The same idea with Gamma Knife. And so all those beams are crossing at that little pituitary tumor.
And who's the one who makes the ultimate decision about how to treat these? Is that you, the endocrinologist, or do you get together? Or?
So it's a team approach. So usually a pituitary tumor patient will first see an endocrinologist to sort out what type of tumor it is. its size, configuration, and then usually a neurosurgeon is then asked in consultation to see the patient. So really the best management is determined by the endocrinologist and the neurosurgeon. And then after surgery, if there's a residual tumor, the decision what should happen to that is also the endocrinologist, neurosurgeon, but now a radiation oncologist.
I'll tell you, the pituitary,
Wow.
there's a reason it is called the master gland. It produces a variety of hormones that control multiple bodily functions. And if one thing is going to go wrong with the pituitary, and 1 of 5 of us probably has one of these, but at least we hope it's asymptomatic, it's a pituitary gland tumor. Almost all of them are benign. They can be a little bit difficult to diagnose, but fortunately most of them don't require treatment. But when treatment is indicated, you get together with your team. You know, the team approach is a big deal at the Mayo Clinic. Like Lynn Berry always said, when you go to the Mayo, you don't get a doctor, you don't get a nurse, you get a team. And we often use the team approach, as we've heard from endocrinologist Dr. William Young, to treat these unusual pituitary tumors. Dr. William Young, thanks so much for being with us. Really appreciate all the great information.
Thank you. Glad to be here today.